If you're recovering from a heart attack or you've been diagnosed with a heart problem, your healthcare team will probably suggest that you join a cardiac rehabilitation program. Cardiac rehabilitation is a medically supervised program of exercise, emotional support, diet and health advice that can really help improve the well-being of heart patients.
If you take up the rehabilitation program, you've probably got a 20% reduction in your cardiovascular risk, a 1 in 5 reduction in risk. It's better than playing the lottery, that's for sure. It's also going to make you feel better, physically, but also mentally.
I'm here because I've had an angioplasty done and I just need to exercise to get my heart rate going back to normal. So I need to lead a normal life, and I think the exercise will help me do that.
On the programme, you'll get support and advice to help you work out ways to lead a healthier lifestyle, and if needed, help to stop you smoking too. You'll also be able to meet other people who've been through the same experience as you.
Don't sit home and don't think they are alone. There are a lot of people suffering from this kind of disease, illness. They don't sit at home. They should have come out and share the problems so they feel much better.
Before you start rehabilitation, you'll have an initial assessment to discuss your goals for recovery and to work out how much exercise you can safely do. You'll also receive regular cholesterol and blood pressure checks.
I like to see people with smiles on their faces, and exercise doesn't have to be something to endure. Exercise should be something that you want to do.
The physical exercises are designed to improve your heart and circulation. Starting slowly, you'll gradually increase your movements over the course of the programme.
I feel much better when I walk out of here than when I come in, you know, so I really enjoy it.
I walk better, and I feel better for the first time in about 2 years.
For anyone with mobility problems, your cardiac nurse will tailor the workout to meet your own specific needs.
It's designed around you, and it builds things up slowly so that it takes you from your level of fitness currently to where you will be in about 8 weeks' time. And it's a program that varies in length, but it's not going to be shorter than 4 weeks, and it's unlikely to be longer than about 12 weeks because there are other patients demanding the same rehabilitation that you're needing.
The rehabilitation team also includes dietitians and psychologists to help you with other aspects of your recovery, such as diet and healthy living, stress, work and lifestyle changes.
The most important thing I like to tell the patients is that cardiac rehabilitation is fun. Don't be afraid, come and join the team and participate. We'll look after you.
What's been confusing about that is that it's given you the nutrition information.
Despite its benefits, some patients worry that cardiac rehabilitation will be too difficult for them, or it won't fit in with family life. Pauline Edwards was worried the physical exercises would be too much for her, but she soon found her life changing for the better.
When I first heard about the cardiac rehabilitation, I was a bit dubious. I thought, I wonder if that's suitable for me, because you're always a little bit nervous, wondering if you're going to do too much and mess up the work that the doctors have done.
She was very frightened and very scared, and she was nervous, and she had lots of pain, and I kept saying, right, we manage the pain and we get the tablets right, and once we got the symptoms correct and it was under control, I then said, now is the time to do cardiac rehab, are you ready? And she said she was, and then with her consultant's permission, we then exercised her, and she's gradually gained her confidence. She's a new woman, absolutely glamorous woman.
Cardiac Rehabilitation is there to help you improve what you can do, your fitness and your strength. Whether it's returning to work or socialising, helping to relieve anxiety or depression, Cardiac Rehabilitation can make a big difference to the quality of your life.
Well, the one thing I would say to a cardiac patient is to give it a go. Attend your initial assessment with the Cardiac Prevention and Rehabilitation team, and you will see a difference in your recovery, and it may save your life.
If you're able to actually take a positive view on your diet, come. If you can take a positive view on your exercise, come, because you're going to gain something from it.
Come once and you will come again. I think that's the thing. Yeah. Or get a friend to bring you along.